So, yeah, dude, I thought a lot about how to start this and how to get into it, because it's really weird for me to do this. I obviously talk for a living, but not normally to my girlfriend, which you are. So for the benefit of people watching, which Sarah is, Sarah and I are boyfriend and girlfriend.
Oh my God.
And we love each other. And Sarah is also somebody who's had first-hand experience of dealing with the COVID-19 pandemic. And from my perspective, I've always felt like the story that you have to tell is one that I think a lot of people would benefit from hearing. And I think it's a side of this whole mess that like a lot of us don't get to see. And I get a small glimpse into it because obviously we share it with each other. But I know that this was important to you to sort of say that, you know, we're not trying to, this is not like an expert giving advice or an opinion.
Oh, absolutely, yeah. This is completely just my experience so far. I mean, I'm relatively new to my career as well, and by no means a professional. But it's really just like, it's what I've experienced so far.
And I think at some point, you know, as we warm up, it's going to feel like you and I talking like we do when we're at home.
Yeah.
I remember just before the pandemic sort of like blew up and it was just around the time like we were starting to date. And I remember when you had told me like you were scared.
It was difficult to imagine, you know, looking at where we are now, like imagining what was going to happen. So I think just the uncertainty of it, and also like wondering what was going to be expected of me. Yeah, looking back now, it was a lot.
What do you remember about sort of things starting?
When it started, I don't think anybody thought it would be like it is now. I imagine, or I remember speaking to colleagues and saying like, it's like we're standing in front of a tidal wave and just waiting for it to hit, because we were looking at places like Italy and the UK and seeing how bad it was there. Yeah, I mean, we were terrified, but we didn't know, I didn't know how to feel. I thought, you know, I've made a promise to look after people as a nurse, and it's like whatever comes at us, we just have to face.
You take an oath, right?
Yeah, it's called the Nurse's Pledge. I know there's a few different variations all over the world, but it's basically like Florence Nightingale's, you know, pledge. I can read it if you want.
Yeah, sure. I'd like to hear it.
I solemnly pledge myself to the service of humanity and will endeavor to practice my profession with conscience and with dignity. I will maintain by all the means in my power the honor and noble tradition of my profession. The total health of my patients will be my first consideration. I will hold in confidence all personal matters coming to my knowledge. I will not permit consideration of religion, nationality, race, or social standing to intervene between my duty and my patient. I will maintain the utmost respect for human life. I make these promises solemnly, freely, and upon my honor. So that's the pledge. And I mean, COVID or no COVID, this is, you know, what most nurses, I hope, live by.
It's crazy to me how, like, in the deep end you got thrown. Because I guess because there was no alternative option, you sort of had to.
As I started nursing, you know, even when I was still studying, ICU was always a big interest of mine and always somewhere where I imagined myself being. So, yeah, they said, well, Sarah, are you willing to come and help? And of course, you know. But yeah, as soon as I said yes, I
realized, shit.
Yeah.
What's the setup? So, I mean, at your hospital in particular, it was the medical ICU ward that sort of like became the COVID ward.
So that's the biggest ICU that we have in our hospital. So, and also what was great is that there's an isolation side and then just like the normal side, I suppose. But obviously now the whole thing, it's an ICU made up of 20 beds. So now the whole thing obviously it's all COVID. So that ICU, I guess, had the best.
It was best equipped to.
Yeah, it was best equipped to handle the isolation that was needed, and you know, just to protect staff and patients.
So when you say like the isolation, do you mean like, so if somebody comes in, someone's sick, but you don't know that they've got COVID, they've got it's like a patient under investigation, I think you've told me.
Yes, yeah. So that's called a PUI. So they would essentially first, they go through trauma. There's a whole process to it. They go through trauma, and then depending on the severity of the disease and, how far they are along, they'll go either to a ward. So we have wards also dedicated just to COVID. If they're still awaiting their results, they go to the PUI unit, where they're treated as if they have COVID, but their results aren't out yet. And as soon as it's confirmed, then they'll be moved to the confirmed unit. So I'm in the ICU, so that's when, the disease has developed to the point where they need constant oxygen, constant monitoring. So their oxygen saturation is constantly being monitored, their blood pressure. We do daily bloods, we do x-rays, just to monitor the patient.
It must have been really crazy in the beginning, as more and more people sort of realize that we don't really have a handle on exactly how this thing is affecting people.
Yeah, well, looking at the first wave, we didn't know what to do. We were losing a lot of patients, a lot of people were passing away. It was incredibly traumatic. And I'm sure for the doctors as well. Well, obviously, for the doctors, I can't imagine that strain and that pressure that was put on them. Decisions that they had to make, and then for us to have to follow through with those decisions, and to continue treatment or to not continue treatment. It's baffling. I don't think I processed properly, but we didn't know what to do. We were trying a lot of different things, but now I feel in the second wave we have a handle over it.
Kind of been learning as you go. I think that's been the case for the entire world, right?
Yeah, what works, what doesn't work. We've learned a lot about it, but I feel like there's still a lot that we don't know. What are the long-term effects?
Do you remember the first time that you lost someone?
Yeah, it was a complete shock to me. I think it was my third day there, second day. So obviously I hadn't experienced losing someone to COVID. And I just remember, he didn't look good when I came in, but I didn't know, what the progression was. I didn't know what it looked like in the last, in these last few hours. So I noticed his vitals started to drop, his SATs started to go down, his blood pressure. As soon as we start to see the patient deteriorating, we intervene with different types of medication. That would start immediately, and with this patient it wasn't working. So I remember calling my senior, the shift leader, and she came, and we watched the monitor, and he just eventually he stops breathing. He was ventilated, so obviously he was still breathing. The ventilator was still breathing for him, but he was gone. Obviously they flatline. And at first, we weren't actively resuscitating patients just because we were worried of the spread and of our safety. And there's a lot that goes into it, the decision that you have to make. He passed away, and I just remember it was I couldn't believe it. I was in disbelief. It's always a shock. So, I couldn't. I remember just going into our tea room and just crying for like 10 minutes. I couldn't handle it. But there comes a point where you have to pick yourself up. And you have to be strong for your next patient. You have to be strong for your colleagues. Imagine if we were all just running around crying, it wouldn't help anyone. So you have to kind of just bottle it up and go and carry on. And so obviously then, you have to inform the family. And for me, and I'm sure everyone will agree with me, every single healthcare worker, it's dealing with the family and knowing that this wife or this husband or the daughter, they haven't seen your patient for the past 10 days or 2 weeks or whatever. Last time they saw them, they were okay, and now you're calling them and you say, I'm sorry, he's gone, he didn't make it. So that's the hardest for me, is just imagining that family, and like, what if this was my dad or my mom? Yeah. That's tough, being that middleman, that's tough.
Do you get trained in how to do that?
Not specifically. For, as you study and as you gain experience, obviously you learn like how to be sensitive how to convey messages in the right way, and also like what's legal, as you know. Obviously, the doctors have their responsibility, and you have your responsibilities.
I suppose it's different with the pandemic, right? I mean, very often if somebody is going to pass, the family would be by their bedside and
of
have
course
a chance to say goodbye.
Yeah, in normal circumstances, we the family would be in there, and and you'd support the family as well as a nurse, but now over the phone it's just not the same. But we did, as time went by, we were making special exceptions, for just one family member to come in, and obviously at their own risk. But it's not the same. It's you're going in there without your other family members. You don't have support. I find it's incredibly heartbreaking.
I mean, even for me, from my side, I spent so much of my time, especially I remember in the first wave, trying to think of ways to make you feel better or distract you from things.
Yeah.
And I kind of, I think, well, what can I do? Maybe make something for you or record something, because that's what I do.
Yeah.
But at the same time, I can't even process what you must go through.
I don't think I've processed it either. I mean, talking to colleagues especially, I find that's a great support. I feel like there's a sense of solidarity between us, not just nurses, it's everyone involved, the whole multidisciplinary team. We struggle to wrap our heads around what is actually going on and the things that we go through. And at the time, you're thinking this is crazy. Is this really, this is happening? And yeah, we don't, I mean, you come home and I try and tell you, but it's no one knows if you haven't been there.
Yeah.
Yeah. And it's crazy to think that some people still aren't on board with this. People think it's a conspiracy theory. You have people not wanting to wear their masks, people saying it's been created by the government, and it's crazy.
Yeah.
Do you not see? No, people don't see, I suppose, hey?
Well, they don't see what you see, man. And
we see the end of the line with this thing.
I mean, some of the ways in which you've described it to me, I mean, just people, the volatility of it, how somebody can come in and seemingly be responding to treatment.
It's insane. It's people's conditions change within hours. One day your patient will be talking to you and they'll be fine, and you'll think oh no, we're doing great here, really. And our doctors as well, they, often I feel like we're all just stumped. Then the next day you'll go in and he'll be intubated. You're like, what happened?
One of the reasons that I've often thought that's so tough for you is because we spend so much time in our lives trying to make sense of life. So life must have order, and you must be able to work out how something's going to happen. We're all racing through this crazy existence, just trying to do that.
Yeah.
And suddenly you've got this virus that's not fair. There's nothing just or fair about it.
No.
And there's nothing that we can do to, it's here now and it lives with us, but it doesn't have it doesn't think how we think, it doesn't reason and how we reason. And so as humans, we're trying to fit things into boxes, but it doesn't work out that way. You know what I mean? And I think that's probably what creates a lot of, in your case, a lot of the
anxiety. COVID doesn't discriminate.
Yeah.
Nobody is, safe.
You must feel quite angry or despondent a lot of the time if you encounter somebody that is, say, more on the denialist side of things. But I mean, you don't...
I get angry.
You keep that in, I think. Hey?
Yeah. Talking about this even, I struggle to convey how I feel.
Do you think it's because you're trying to push it down a bit?
100%. So I remember in the last wave, talking to Ian. He's my brother, a psychologist, for those who don't know. Just talking to him and saying, I'm worried that I'm losing my humanity. Because, my patients would be dying and I wouldn't feel what I used to feel. And that scared me. And I spoke to colleagues and they said, Sarah, you have to keep going, you have to keep moving on, and the next patient, it's hard to talk about.
It's okay.
this is why a lot of older healthcare workers might come across as, like uncaring, but it's from this.
No, I think you've got a tremendous amount of humanity. I think
Thank
you. No, but I do. And I think you have to do what you do. And I don't think it's maybe the trade-off of having humanity or not having humanity, but it's perhaps the trade-off of having to see things in a different way to which the rest of the world gets to see them.
Yeah.
And that's a sacrifice that you have to make.
Yeah.
And part of that sacrifice means that other people might look at you in a certain way and think certain things of you. But that doesn't make it true for you.
Yeah.
It doesn't mean that you've got any less humanity or empathy or ability for compassion. It just means you're strong.
You're trying to be, at least. Yeah. You have to. You have to keep moving. And I remember, like, a lot of the time, I've felt so despondent and, like, thinking if anything is going to make me not want to be a nurse anymore, it's this. I don't, like, why? But it's easy to think that way, but I feel like I've turned myself around and I've thought, like, come at me, let's go. So it's been an incredible time for me to grow personally and professionally. This was like, it was insane. It was like a crash course. It's like, let's go. Yeah, it was, it's like, you don't know how to work this ventilator? Well, you're going to know now.
Yeah.
Yeah, it's insane. So, I'm grateful to have experienced this, you have to try and look for positives too. So I'm grateful to have been through this and to still be going through this, and I feel like I've become stronger.
There was a time that I remember during the first wave, maybe like a month and a half, 2 months into it, where you would come home and just tell me stories of, we lost 4 people, 5 people.
Yeah, in a day. It's hard to wrap your head around it.
I can't.
No. You're in the business of helping people survive and saving people, and then just having this happen, it makes you feel like a failure. Often we had 4 people crashing at the same time, and what do? You're only, oh my word, and the short-staffed problem, being short-staffed, that, because we had nurses getting sick, nurses having COVID, and then obviously they have to go into isolation for 14 days, or depending on how bad it is, and then what do? It's been so difficult to provide the level of care that you want to. But what I've seen, it's been amazing seeing nurses now who I just I look up to so much. They're just incredible people, and yeah, it makes me proud to be a nurse.
Well, that's how I see you.
Yeah.
I remember during the hard lockdown, and this, we weren't seeing each other at this time, and you'd often, because we'd speak on the phone, and you'd tell me how weird it is to kind of be out in this world that nobody else is in.
Yeah, it was so strange, leaving the house and the roads are empty, and in Joburg, that's unheard of. And getting onto the freeway, and you're the only car for a kilometer. And every day seeing the grass on the side of the road growing longer, it was so eerie, it was weird. And then you hear people saying, oh man, I don't want to work at home anymore, I don't want to be at home, and this music festival got cancelled, and I can't believe I lost my money. And that's, it blew my mind, because all I wanted to do was be at home. When things got overwhelming and scary, I didn't want to go in. So for me, I felt like I was in a parallel universe almost, compared to everybody else. And people would be like, oh, hey Sarah, how's your day? And
fucking sucked.
It sucked, yeah. So it was really tough not having someone understand.
So you've let me read your journal. Would you? And I know it's very personal to you, and I know you've got it with you. Would you mind reading something from it? Is that okay?
Okay. How after heavy lockdown passed and people started to get back to normal, they forgot about COVID. But it never went away. We still had patients, yes, much improved, and cases were few, but still there. It gave me hope for a second, great, maybe I'll be able to see mom and dad at Christmas, and maybe I'll finally get that leave, and maybe we can still take that trip. Then things started up again. I remember a particular day when we started admitting more suspected COVID cases and running past a co-worker with emergency drugs or an oxygen cylinder, whatever, and saying it's happening again. That realization, can we not?
Yeah, man.
Please,
I remember us having a conversation and you sort of saying like, dude, I haven't processed the first wave. I don't know if I can do this again.
Yeah, I don't want to.
Why should I have to do this again? I just did this.
Yeah, When I went back to work, I told myself, Sarah, this is your job now. This is how it is. Go, at least now I know what to expect from the first wave.
I remember, obviously, wasn't that long ago, but when you did get COVID, I suppose in my own mind, I had always just assumed you must have been asymptomatic and had it already, because, just being in that close proximity to it every day, it seems crazy that you didn't. Maybe it's also just at this point like worth talking about the PPE and stuff. That must be like really shit too.
So, we wear layers of PPE. We'd wear one gown, and then you put another gown on top of that, 2 pairs of gloves, you'd wear overshoes. So we had like these long boots that came up to our knees.
Hot.
Incredibly hot. Like you were just sweating under there.
I was making a joke and saying you probably looked hot.
Oh, no. No, I did not. You saw pictures. Yeah. And I remember in the first wave I tested twice because I felt, a bit under the weather a few times, but that could have also just been fatigue. But I tested twice, both times it was negative. And then going into the second wave, just before the second wave, it was around the time when we were moving.
Yeah.
So I thought, I'm tired. I've been carrying boxes all day. Obviously, I'm not going to feel myself like 100%. And then I just remember one day my chest started to get tight. And that's not like a common thing when I get sick. Usually I feel like my throat gets sore first, but then my chest started getting tight and I'm like, this isn't right. I felt very out of breath. So I remember like that afternoon being like, okay, this could be COVID. I'm going to go test.
Good test, yeah.
And then the next morning my results came out and I was positive, and it was like, it was... okay.
It's surreal.
What do we do now? Yeah. And I wasn't that sick. I wasn't too bad. But then I feel like the days that followed, it was
you had some bad days, definitely.
It was quite a dark time, I just remember my worst symptom being fatigue and just feeling like I couldn't move my body without feeling like I've ran a marathon.
Yeah. I remember you took a shower one day.
Yeah.
And then slept for like a few hours afterwards.
After that, being like, whew.
Yeah, it really took it out of me.
Hygiene is hard.
Yeah.
So that was incredible. And then just feeling, just lying there thinking like, people who I've seen being so sick and needing oxygen and being on ventilators, how must they feel? Yeah. It's I think you lose your mind. Yeah. You're not yourself. Yeah. So just imagine dying like this. But I made a speedy recovery. And then I was back at work.
Yeah, straight back into the fire.
Being able to do what I do and trying to help in whatever way that I can, and even if it's just making the last few days comfortable for someone, that's honestly a privilege.
It's weird to talk to you like this.
It is weird. But
I'm glad we did it.
I also just want to say, like to people listening now, whenever it is, even if all of this is over, this sounds so cliche, it sounds ridiculous, but you need to make the most out of your life.
Oh yeah.
And do what you want to do and go, and I've realized that I want to do more, and I'm going to.
I love you and I'm proud of you.
I love you too. Thank you.
5FM. Watch 5FM TV on YouTube. 5FM.